All right, we'll get started. Hello, everyone. Thank you for joining our webinar today, Hip Hip Hooray, How Hip Mobility Can Affect Total Body Health. My name is Vinitha Komareddy with Victor Kilo, and I will be your moderator today. Victor Kilo provides an array of services such as brand management, website design and development, business transformation consulting, social media, and live event support such as this webinar. Throughout this live today, there is a Q&A button at the bottom of your Zoom screens. So if you have any questions, please ask them there and we'll address them at the end of the session. For our viewers joining us from Facebook, please post your questions in the comment section and we'll add to the question list for our speakers to address. I'm happy to introduce David Reavy from React Physical Therapy and our other speaker, Eric Owens from Delos Therapy. David Reavy is the founder and CEO of React Physical Therapy. He attended University of Illinois at Chicago and is a board-certified clinical specialist in orthopedic physical therapy. David is also a regular contributor to Men's Journal and is a valuable resource for his work, translating into higher levels of function into patient population. Through clinical work, David has developed his own approach, the Reavy method, which is recognized by the Illinois Physical Therapy Association as a continuing education course. The Reavy method focuses on balancing the body through dynamic assessment, weakness, restriction, localization, through muscle testing, muscle release, and muscle activation. David's goal is to not only bring patients back to the level of functioning they had previously known, but to help them become balanced and stronger than ever. Welcome. We also have Eric Owens from Delos Therapy. Eric earned his bachelor's degree in biochemistry with a minor in physics from Texas Wesleyan University, as well as a master's in biomedical science and attended medical school at Midwestern University. He's also a decorated professional table tennis athlete who's a 9-time national team member, competing in 6 world championships, national men's singles champion, 2-time national men's doubles champion, 2-time North American doubles champion, Pan American Games gold medalist and bronze medalist, USA Athlete of the Year, and also has been inducted into the USA Table Tennis Hall of Fame. Alongside Delos Therapy, Eric is also a co-founder of Delos Institute, Delos Robotics, and now Delos Gumdrop. Without further ado, I'd like to welcome David and Eric. How are you both today?
Doing great. Thanks for having us.
Doing great. Yep. Excited to be here.
Wonderful. I think this is a really great topic for both of you. David, we'll start with you on hip mobility and what are some common hip problems you see patients with and who is most likely to have these types of ailments?
So a lot of the hip issues that we deal with at React Physical Therapy is femoral acetabular impingement syndrome, so what they call FAI. And so what happens is your pelvis, which is your foundation, because you have a hip joint, right? So your ball sits in the socket. And so the socket is your pelvis. So the ball is dependent on the position of that socket. So a lot of times sitting can disrupt that connection. And so in order for the hip to properly function, it should be centered in that socket. So all the muscles work together. And so a lot of times when we sit for a prolonged activity, prolonged times we're at the computer, we're working, our hip flexors get really tight. And so what happens is it causes the pelvis to tilt forward. And so when that pelvis tilts forward, it disrupts the kinetic chain. And so your abs aren't firing like they should, your glutes aren't firing like they should, as well as your upper body, your posture. So all those contribute that to FAI. And we see a lot of those issues within physical therapy. In addition to that, because your glute is shut down, we also see Piriformis Syndrome. And so for your body is you get pain wherever you have I feel like your weakest links is where you get pain. So when your glute shuts off, your deep hip rotators work a lot more. So your piriformis, you get Piriformis Syndrome. You also can get some IT band syndrome, glute med tendonitis. A lot of those are very common issues with lack of hip mobility, lack of hip function.
Yeah, and I can attest to that. I went and saw David yesterday at React Physical Therapy out in West Loop and had a little bit of a tight left hip, and he took me through his protocol and immediately got better. So I now have a very good understanding of exactly what he does and how it can help. And Delos does a lot of similar aspects. Really what we focus on is muscle pliability. And so you could have pain and stiffness in the front of the hips, the side of the hips, the back of the hips. And when you talk about muscle tightness, it's important to understand what is connective tissue, what is tightness, right? It's sort of an interesting question. Ask a friend, ask a professional, what is tightness? You won't get very good answers. So let's define what tightness is a little bit, right? So you can think about every single muscle fiber. It's actually wrapped in connective tissue. We can call that the endomysium. You put a bunch of muscle fibers together, and that group is called a muscle fascicle. Now that's inside the muscle. Those fascicles are designed to be able to move in all of these different directions. They're supposed to slide and glide. They should be able to rotate to enhance normal movement. Now you can imagine these fascicles, which is about 100 muscle cells that are in there, they get stuck together. You get these adhesions between these fascicles. We can call that a fibrosis, where the fascicles don't move really well. And so that can happen on the front of the hips, the side of the hips, the back of the hips. It can happen anywhere. But really what we do is, instead of foam rolling and massaging across the surface, you can imagine if I have two fascicles that are stuck together, going across the surface doesn't separate them. So we figured this out many years ago, is we apply pressure right between those fascicles and we separate them. Now they can move and they can rotate and they can slide and glide. You get lubrication into that tissue. It's a wonderful way to truly loosen up the hips in all directions. And once you do that, that's true mobility in the hips. And to me, that would be sort of a phase one. And phase two is retraining all of those. And you can do those phases together. And that's one reason why David and I work so well together, is you can do PT and Delos at the same time. But it's really, really important to break free of those adhesions, because they can be very, very dense and they can form over decades. So breaking that up and mobilizing it is an excellent way to relieve any kind of stiffness or pain inside the hips.
That's great. You guys, you both talk about, sitting all day. I'm guilty working from home, whether at my desk, whether on my couch, whether in the kitchen, right? So I think, some of these tight hip flexors, if most, if not all, come from sitting all day. And, David, when we spoke, you were talking about prolonged sitting and active sitting. Can you talk a little bit about that as well? And how do people sitting all day can alleviate some of this tightness and before they come see you and Eric?
Absolutely. So when you're sitting all day, there's different types of different ways to sit, right? So you want to be able to sit on your sit bones. And obviously you're not going to be able to use your glutes because you're sitting down, but you want to be able to recruit your core as well as your lats. Now your lat crosses over 32 joints. So it holds it maintains your posture. And so the position of your pelvis dictates how your spine sets, right? And so basically your pelvis is your foundation. And so when I look at the body, your pelvis is your most independent variable. Everything is dependent on the position of the pelvis. So if your sacrum is backwards or twisted, then your spine is going to be that way, opposite. And so your sacrum is your counterbalancer for your spine. So you want your sacrum to be tilted about 35 degrees. And so when that happens, you get that natural curve in your lordosis, in your low back. And so that right there will help your abs work better as well as your lats work better. And so your pelvis, you want it to maintain a neutral position. You don't want it tilted forward or tilted backwards. When it's neutral and you're in a prolonged position, you get a proper co-contraction from the front of your muscles and the back of your muscles. So positioning is very important. How you hold your head is very important. So if I slouch like this, so my upper body comes with it, right? So if I keep my head up, then I'm more upright. And so the position of your pelvis, the position of your head dictates how your muscles work. And so you want to make sure that if you're in a prolonged position, you want to recruit all your muscles, not just passive structure. So a lot of times when we sit slouched, we're just hanging on to our fascia. And that right there, you're not actively using your muscles. And I always say, what's the point of going to the gym if you're just strengthening them for an hour a day? Like, you should be using them all day. Those muscles need to work. They help you move. Your muscles move your bones. So a lot of it is retraining. A lot of it is, as Eric said, opening up those that soft tissue restrictions, so then we can get the joints to move and then we can activate the muscles properly. But active sitting is key.
Yeah, and I think I straightened up my posture as soon as you said, put your lats back and sit up straight and put your head back. Right? So I think a lot of our viewers probably did the same thing as well. Eric, you had mentioned decades of tightness, whether in the hips and your IT band, and David was talking about this as well. What about people standing all day? It could be the first responders, nurses, hospitality and service industry. What type of tightness or ailments do you see with that industry? Eric, we'll go with you first.
Yeah, it's interesting. When you look at connective tissue or fascia, those words are used interchangeably. Fascia is made up of collagen. And when you take muscle biopsies and fascial biopsies and you look at them under the microscope, they have very, very specific orientations relative to muscle tissue on a macro and a micro level. It's about a 55 to 63-degree angle relative to every muscle. So everything is at a diagonal, and that allows a nice slide and glide without a lot of friction. So you want to maintain that angle. You can kind of think about it like a spring. If you start to pull a spring apart, you'll see those coils are at an angle. So that allows a nice extension and a nice efficient recoil. That's how you want your fascia organized at all aspects and all levels. Now, inactivity disrupts that organization. So we don't necessarily get more and more fibrosis. We can under very, very specific circumstances, but whenever we're not really moving very much, the tissue can become dehydrated. You can get some fascial adhesions, and we're really disrupting that very, very precise organization. On the flip side of that, anytime you move, anytime you're driving force through a muscle, through the connective tissue, your body's trying to make that movement more efficient. So it will lay down collagen in the line of force, in the line of tension. It's actually a good thing because it allows sort of collagen tracks to allow movement through it. Now imagine doing that all day, every day, year after year, decade after decade. The body's simply responding to what you're doing. So those collagen tracks can become very thick. And when you add, refined sugars and advanced glycation end products and inflammation, these studies have been done. Those tracks become very thick and very fibrotic, and they typically happen inside the muscle between the fascicles. And so when you're sitting all day and you're not moving the fascicles back and forth, they can get stuck. They can also get stuck through many, many years of repetitive movement and not physically separating them. So separating them periodically before they all get stuck together is critical. Unfortunately, most people that come to us, they're already stiff, they're already in pain. So we have to reverse that damage. And essentially all we're really doing is targeting with precision where we find that muscle fibrosis. It's very obvious. The tissue will feel very hard, and muscles should always be very soft. So this is sort of the example I always give. If I flex, this muscle's hard. If I relax, it's soft and spongy. Feel the area of somebody that feels stiff or is in pain. Feel that muscle. It will be like a rock. And applying pressure in there, breaking that up is an excellent way to free it.
That makes sense. And I think, a lot of the soft and hard muscle, I think, everyone's under the impression you should, if you're working out and you want that definition, it should be hard. But in reality, it's just tone and definition with soft muscle.
Yeah. And let me clarify that, right? If you feel a big bodybuilder, believe it or not, their muscles will feel very, very soft and spongy. They sort of have that hard body appearance because the skin around the muscles pulled very taut. There's not a lot of water or body fat. So it will look hard. It's sort of an illusion if you feel it. And I've done this with many, many bodybuilders when I'm training new therapists. I'll say, feel their quads or feel their shoulders, and they're massive, very low body fat, 3-4%, and their muscles will feel incredibly spongy, assuming there's no dysfunction. But feel a part of their body, even a bodybuilder that feels they tell us it's restricted, it doesn't grow very well, it's weak. Feel the muscle in that area. It will be very hard in a relaxed state. Our muscles should always be soft and spongy. They should be very dense when we contract them. But if they feel hard in a relaxed state, that means they're chronically contracted.
David, Eric talks about densification in muscle tissue. I think a lot of people may or may not know, but, is there something else that might be causing my hip pain? What could be that source of my hip pain? Will it render itself right in my hip if I, you were talking about posture and, alignment. So will people see hip pain at that source and that location, or will it manifest somewhere else?
Yes, absolutely. I mean, the way you move is your body is one unit. So you use your body together. And so there's research out there that shows that if you sprain your ankle, you're going to have hip or back pain later in life. you're more apt to have that. So when you sprain your ankle, you're typically an inversion sprain was when the ankle goes in, the foot goes in. And so you tend to walk on the outside of your foot. And I would like everybody to do this, walk on the outside of your foot. And when you do that, you're only really using the passive structures. You don't utilize your glute. And so if you continue to do that, then the fascia on the outside of your leg becomes really restricted. You don't recruit your glute. And so if you don't use your medial arch, your first ray or your big toe to push off, the ball of your big toe to push off, you don't use that medial arch. And that doesn't recruit your VMO or your glute. And so that decreases your functional performance. That causes a lot of times the Q angle of your knee to come out of alignment, and you just can't turn muscles back on. And so I see a lot of post-op or old ACL patients that never got back to their full function. And a lot of it's because they sprained their ankle 2 weeks before or a month before. And so a lot of times it's like getting your foot back to move properly, to align your knee and your hip properly. And that will help a lot with that. In addition, posture plays a huge role. And so your whole body is connected. The way you move is a reflex. And so if you're having pain, that reflexive system is disrupted. Like obviously your body wants to function, right? And so one of the things with the body is your eyes want to be horizontal. So if I have bad posture, my eyes still want to be horizontal. And so with that said, you want to be able to bring your upper body, right? Getting your lats on, getting your posture in better position so your muscles work together. And so if you look at your thoracolumbar fascia, you have your lats that attach there, your abdominals attached there, and your glutes attached there. I believe true function is getting those big muscles to function together, getting your abs, lats, and glutes to work together. And so a lot of that comes through the whole kinetic chain. And so I typically start at the pelvis just because it's the most independent variable. Everything is dependent on that. And then your body kind of, through the dynamic testing of the Reavy method, your body tells us where to go because it's a reflexive system. And so the order of how you do certain things matters, how you strengthen, what muscles should I turn on first. And so it's very important that you need to understand that your body. So everybody that comes in to React Physical Therapy has a different treatment plan based on their body. And so that's one of the unique things about React Physical Therapy is the Reavy method, because of the fact that we treat the individual. We don't just treat your symptoms.
You talk about what muscles should turn on first. Are there three that start with, or like you said, is it individualized treatment plans? What does that look like from muscle activation?
So from that standpoint, a lot of common things that we see is people don't use their core properly, right? And so if it depends on the position of your bones. So if your pelvis is tilted forward, I know you're going to need some abs stabilization exercises. So if your pelvis is tilted forward, then your hip is in a bad position. You need to bring that pelvis up so that glute can basically bring that hip backwards. So anytime you walk, you push off, you're bringing that hip backwards with every step. And so the joint needs to move properly. So if you don't get that push off properly, that glute's not going to contract. It may contract at 10%, but it's not going to contract fully. And so I'm a big believer that you should feel the muscles work when you do exercise or when you do train. And so a lot of times it depends. But the biggest thing is pelvis, making sure that your posture is ideal, and then in a good position, and how you walk on your foot. And then the alignment with everything else in between.
Great. I love the Reavy method. I love hearing about it. I think it's really a different insight into physical therapy as a whole body approach. So thank you for sharing that. Eric, David talks a little bit about compensation. So what do you see with your patients in compensation and muscle tightness?
Yeah, I mean, anytime you're moving, whether you're walking, running, doing some kind of dynamic athletic performance, you can think about muscle contraction. You're never really just contracting one muscle. You're contracting groups of muscles, assuming you're moving in a dynamic way. So there's a wave of contraction that goes through an individual muscle and through surrounding muscles. It should be a very smooth wave of contraction. Now, remember, the force that goes through a muscle is actually transmitted through the collagen network inside the muscle. And as soon as you get a fibrotic mass of collagen where the force cannot go through evenly, your body's very smart. It doesn't just stop moving. What it will do is it will work around those areas. If our wave of contraction is 1, 2, 3, 4, but there's a fibrotic bundle on 3, You go 1, 2, it bypasses that, it goes to 4, 5. So you start recruiting other muscles to do jobs they're not necessarily precisely supposed to do. So that wave of contraction becomes disrupted. And now you get neurological adaptation on top of that. So now the wrong nerves are firing, and everything just starts firing in the wrong order. And that leads to really, really catastrophic problems long term, because now not only do we need to physically remove that blockage, remove that adhesion, but that's just part of the story. Because if you train the muscles to fire around that adhesion, even if you loosen it up, neurologically, you will still be firing around it. And so allowing a pathway of force through the muscle is really, really step one. And then step two is forcing the wave of contraction through that tissue to retrain the muscle, the fascia, and the neurological system. And that's how you really create a good balanced body. And so at Delos, we're always focusing, we might focus very specifically on one area to remove that adhesion, but very quickly, we want a whole body approach, because we want their whole body pliable, we want their whole body loose, and we want the waves of force and contraction to go through the muscle very evenly.
Great. We have a couple more minutes, but I wanted to make sure that we do get to some questions. So David, quickly, if you can explain, how does React Physical Therapy treat hip pain with the Reavy method? And I know you talked a little bit about it, but just to recap for our viewers, what can people expect when they come to React to treat hip pain and these other ailments?
When you come to React, you're going to have a paradigm shift of how the body works together. I think you're going to not only get education, you're going to feel better. And then you're going to know what exercises that you need to do where your weakest links are, so that you turn on those weakest links before activity. And if you're sick for a prolonged period of time, you're going to know how to do a functional dynamic warm up to turn these muscles on, since you've been inactive for a period of time. I'm a big believer, like I give all my athletes a functional warm up specific to them. There's a general one, and then there's a specific one depending on a patient. And you want to be able to make sure that you turn your muscles on before activity. There's a lot of times people will run and like, oh, that first mile is the worst, and then I loosen up. Well, the activity shouldn't loosen you up, especially if you're running on concrete, right? You should be the muscles should be engaged immediately, like prior to performing that activity. So you're going to learn more about your body, and you're going to get a lot stronger, a lot faster, because you're recruiting everything.
Great. Eric, same question. What can clients expect from Delos Therapy, whether it is hip pain or other ailments that they're experiencing?
Yeah, in the initial evaluation, we do a very thorough check on muscle pliability. So we're looking for healthy, soft, spongy tissue throughout the body. Now, overwhelmingly, 99.9% of the time when someone comes in with calf pain or hip tightness or back pain or headaches, you press into those areas, the tissue is just full of really, really dense collagen. It's unmistakable. A question I always get is, how did you know on the second press where to go? It's like, when you know what you're looking for, it's screaming at you. It's very, very easy to find. So the goal is to remodel all of that, to take really dense and sort of aged muscle tissue and revert it back to when we're young. David said something very profound there. We shouldn't have to have these long warm-up periods. When we're kids, we go and we sprint, and we don't pull a hamstring. We could be fast asleep, and we get up and we go and we run, and it's easy. We don't ever think about anything. We're not warming up. We're not cooling down. Why? Our body is in unison. The muscles are pliable. The connective tissue is healthy. But when we get dehydrated, when we get fascial adhesions and fibrosis and neurological dysfunction, and our bones are out of place, now we need these long, elaborate warm-ups, and we need cool downs, and we can't sprint anymore because we get hurt. So our goal is to really take this dysfunctional tissue and revert it back to when we were younger. It doesn't mean you shouldn't warm up and cool down. I'm not saying that. But what I am saying is that the tissue is so functional once you restore the pliability that you'll just feel lighter, you'll feel looser, you'll have way more energy. I hear this all of the time about energy levels. I always think about dense connective tissue inside of a muscle is very heavy. It's like carrying around a bunch of dead weight. It's exhausting. But breaking that up, now you're using and recruiting more of your own muscle fibers. Your energy levels will go through the roof. So we take patients through a treatment plan. It's 3 times a week for 4 weeks. We have a lot of science and data to support why that works. We can get into that whenever we come in. But we take them through the whole process. We educate them on why they're hurting, what they need to do. And over that 4-week period, we really change all of it.
David, I think you have a similar assessment with physical therapy. Do you want to speak on that?
Absolutely. So we take them through a dynamic assessment. First, obviously, we take a detailed history, how they hurt, how they got injured, and any other injuries, past medical history. Prior to that, past surgical history. We take all that into account, and then we take them through special testing, and then we take them through the treatment portion is the Reavy method itself. The Reavy method teaches you how to treat. And so the dynamic assessment, it tells you where to go because your body is a reflexive system. So a lot of times certain tissues won't release because of the fact that it's being told not to. It's being told to work. So the position of your bones dictate how the muscle works. So if your bones aren't moving and you're not able to move your bones, then a lot of times those muscles won't fire. And we take them through that, and then we 2 to 3 times a week as well. And then we start them depending on how many issues they have. A lot of times we see a lot of chronic patients and they have multiple issues, not just back pain, but a lot of hip pain, knee pain, all of it, like shoulder pain, neck pain. You'd be surprised how many people just live in pain constantly, but you don't have to. And so it's very specific, and we produce a lot of good results.
Great. And I know that you've both experienced both therapies. So I want to speak on kind of like, where do people start? Where do they start with physical therapy first? Do they start with Delos therapy? How should these be combined, and how can they be complementary? David, we'll start with you on that.
Like me and Eric were discussing this. I think you start them both simultaneously. I think like I was telling you before, I think it's the gold standard from a physical therapy perspective and from Delos therapy, a myofascial perspective. And so as we're treating the whole body, we can't just focus on muscles ourselves. We have to retrain you. And so a lot of times we got to do joint moves to get you to move your muscles, move your bones, and using your muscles. So we're not dedicating the whole treatment session to myofascial therapy, right? And so the complement is going to be great. And I think, like I said before, I think it's the gold standard of treatment.
Yeah, I think there is a tremendous amount of synergy for sure, because when I think about healthy muscle tissue, I think about pliability, and I think about strong muscle tissue. As we age, on average, we get tighter. On average, we lose muscle tissue. Our connective tissue becomes more and more dense, right? Those studies have been done. So if we can restore pliability and restore strength to an aging body, theoretically, we should be slowing down that entire aging process. You shouldn't be hurting when you're 40, 50, 60, even 70 or 80 years old. You should be able to play tennis and rack a ball and go and swim and do whatever you want. You shouldn't have those restrictions, but you have to take necessary steps to break up the years and years of tightness. And we can do that at Delos Therapy. And you can retrain the whole neurological patterns to get the right muscles recruiting in the right order with David over at React. And that 1-2 punch done at the same time, I really think that people would be shocked how great they can feel. You don't need to be limited. You don't need to be stiff. There are absolutely answers for you.
Great. We have a question from the audience. The hips are very engaged for many exercises in the gym: squats, leg presses, side lunges. How can you tell if you are overtraining? What is an appropriate amount of rest? David, you want to take that first?
Appropriate amount of rest. How do you tell if you're overtraining? When you say hips, like what portion of the hips are working? Do you just feel your hips working? Do you feel the front of your hips, the side of your hips? Do you feel your glutes working? So it's kind of like the hip is very, like there's a lot more muscles than just the glutes and the hips, right? And so I just want to know what portion of the hip do you feel working? Ideally, you want to feel everything work. And if your glutes don't come to the party, then everything else is going to work a lot harder. And so a lot of times people will do squats and feel pinching in the front of their hip. And so a lot of times that means you're not using your ab, you're recruiting your ab properly, because a lot of times your hip flexors will be really tight and you have that pinching in the front of the hip. And so you definitely want to address that immediately. And if you're doing legs, or I tend to break my workouts into upper body or lower body day. So I'll do three days a week of upper body, 3 days a week of lower body. And if you're doing functional training, then you need to take a day of rest in between because you're working your whole body in one day. So depending on what you're doing, 3 times a week for whole body training or alternate days for upper body, lower body training.
Yeah, and something to think about for the person that asked that question is, how do you know if you're overtraining? So much of it depends on your recovery, right? If you're doing really, really fantastic recovery protocols, it's actually very difficult to overtrain. Now, of course, there's some genetics in there, there's age in there, hormonal status, diet, caloric intake. There are so many factors, because anytime we work out, we're actually doing some controlled damage to that tissue, and there is a recovery period. But if you're doing some type of myofascial therapy, some type of active recovery, drinking lots of water, making sure you're getting caloric intake, and if you're not feeling weak, right? If you go back to the gym the next day and you're trying to do the same weight and you don't feel weak, and you do feel weak, you're probably not fully recovered. There are many, many variables to think about. And I have no doubt if you go in and see David or you see me, we talk a lot about recovery because we treat a tremendous amount of athletes, and recovery is the most important thing, because if you recover quicker, you can train more often. If you can train more often, you'll be better than your competition.
We have some really great questions coming in. Eric, can start with you here. Do people who have been diagnosed with fibromyalgia get relief with your approach?
So that's a great question. Fibromyalgia is a pretty complex. A lot of people think it's neurological. I rotated in medical school with a lot of fibromyalgia experts, and opinions were all over the place. So I have had cases where they responded wonderfully, and I've had some very, very tough cases. A lot of it depends on just how overactive those nerves are and how dense that connective tissue is. And I'll give you a couple of examples. The amount of pressure that we use is very important. It has to be enough pressure to force those fascicles apart, to get blood, oxygen, to allow healing and remodeling of that tissue. Now, above that, even above the muscle, there are all kinds of mechanoreceptors. We call those nerves, for example, that become very irritated. In fibromyalgia, those specific nerves in the superficial layer of fascia become very, very sensitive. Now, if they're so sensitive, that very light pressure, and I've had this happen, very light pressure is so tender, it's very difficult for me to apply enough pressure to get movement in that muscle. And that can be, it's not impossible, but that could be a very, very tough case. And I've seen that. I've also seen cases where they had fibromyalgia, but they didn't have that level of sensitivity. Those nerves weren't quite as irritated. So I was able to apply a little bit more pressure. I got a lot of movement in those fascicles. We got blood flow and hydration to the area, and we really had fantastic change. So I would have to evaluate you in person. We've had some successes, and we've also had some difficult cases.
David, have you seen patients with fibromyalgia? And if so, how would you go about their treatment plan?
I would take the same approach by looking at the whole body, understanding why they have fibromyalgia. A lot of times, I have heard in the past from a physician standpoint, a lot of it's just a diagnosis with a lot of different opinions, as Eric was saying. And
Yep.
So, I mean, a lot of times I think a lot of it is a lot of muscle imbalances, and then you're not recruiting the right muscles. And so certain muscles just overwork all the time. And then you get all these trigger points throughout the entire body. And so a lot of times your pain just shifts all over the place. And so if we see a lot of hard cases where there's multiple diagnoses. And I think the biggest thing is putting your body in the right position and getting your body balanced so that you're recruiting all the muscles, not just where you get those tender points. And so I think you see a lot of trigger points in areas of the body that you're just constantly overused. And so depending on which pain is the most at that time is when you feel the pain. It's very complex. I've seen, like Eric, some great results, and other times some iffy results, but at the same time, people still do feel relief and are able to get on the plan, depending on how long they had it and how long they've been compensating. A lot of it is you want to make sure that Eric was talking about, like hydration, diet is very key. You want to definitely take the inflammation out of your body through your diet. I think it all plays a role.
Great. David, this one's coming to you. For many a year, I have leg heaviness. Barbara says, I have leg heaviness due to stenosis. This caused me to fall because the one leg drags. Being in my late 70s, is there something that can be done? We'll start with David.
Absolutely. I've actually had a patient in their 80s get glutes again. A lot of it is because the position of your body, the position of your fascia dictates how your muscle works. So if you can change that, then you can get muscles that turn on that never turn on your entire life. And I've seen it. I've actually had a patient, speaking of spine, stenosis is basically a narrowing of the canal, depending on where it is, essential stenosis or lateral stenosis, depending on what part of the spine. And so what happens is if you have a hole like this, and you can see me, right? Through the hole, right?
Yeah.
If a hole like this, then you can't see me, right? And so that's what stenosis is the bones are shifted out of alignment. And so the stabilization of your core is key for that. And if one hip flexor is tighter than the other, that hip flexor will pull that bone one way or another. And so that's why balance is very important, because of the fact that you want proper recruitment. And so a lot of times you can get that heaviness from pinching of the nerve because of the fact the nerves being compressed for a long period of time. Imagine hitting your funny bone, but just staying there for a long period of time. So when you hit the funny bone, you get that zing, right? But if you apply pressure that's constant, then a lot of times the nerve will basically get the muscle from not working properly. But if you can relieve that, there's research out there that shows that nerves do heal. And so if you can I think the first step is taking the pressure off that nerve, trying to get the stenosis, the canal to open up as much as possible. I've actually, speaking of a different diagnosis, scoliosis, I've had a patient that had a 58-degree curve, and she was in her late 70s, and we got it down to 42 degrees. So it depends on how much breakdown of the joint there is. It depends on how fast we can get those muscles on. And how much, like I was saying, there's a lot of things that are structural, but what percentage is structural? Is it 10% structural? And now you're at 90%, and 80 from 90 to 10 is functional, and we can get you there, right? And so it depends. Everything is a case-by-case basis, but we've had great results. And so I would definitely give it a try.
Eric, anything to add about stenosis and relief?
Yeah, I'll mirror exactly what David said. So much of it depends on what's causing the narrowing of that canal. How narrow is it? Is it a shift of all the anatomical structures in that area due to mechanical tightness pulling in one direction or another? We've had great success working, we call it 360-degree hips. We work through the abdomen, low back. We really try to restore balance and pliability back to the entire torso and the hips and everything to see if we can get things centered properly. And that can really, really work wonders. Now, I have had cases where there's some anatomical abnormalities within that spinal canal that is narrowing. And from a muscular and a myofascial perspective, even a bone perspective, things were pretty stable, but there's something happening pathologically within that canal. And they might need surgery or something like that. I would never tell someone that you don't need surgery. We can fix you. If you need surgery, sometimes you absolutely have to do it. It is further down the road for me. I always do everything I can to prevent the surgery. But I think someone should be open-minded to that. Because I've had cases where they wouldn't have the surgery and they were fantastic afterwards. And so it is a case-by-case basis. It just comes down to what's causing the narrowing. And if that's mechanical due to some imbalances, we can fix it.
Great. David, this question is directed to you directly. David, you mentioned a sprained ankle leading to health problems later in life. Can you expand?
Yeah, so when you walk on the outside of your foot, you don't recruit your glute. You actually don't even recruit your inner quad muscle, your VMO. And so when you walk on the outside of your foot, you're not pushing off your big toe. So the ball of your big toe. So underneath the ball of your big toe, you have these two bones called sesamoid bones. And it's actually acts as a rocking chair. And so if you look at your body is an amazing piece of machinery, right? But when it works together, right? And so that's why you feel a difference between one leg versus the other. Oh, that's my bad leg. Well, it's not a bad leg. You just don't use it properly, right? And so when you sprain your ankle, you have to understand that ligaments prevent end range motion. So if you sprained your ligament, that means your bones went past end range, and they're out of place. Has anybody put it back in place for you? And so that's one of the things that you want to be able to do is get that back in place. And then recruit the muscles and understand how to use them again. So one of my patients currently, he's a professional athlete, and he literally has been compensating for 8 years. He had a high ankle sprain in high school. He's now 27 years old. And he always knew his leg didn't work properly. He goes, yeah, it's been like that. His foot mobility is horrible. And he ended up tearing his Achilles. So he tore his Achilles because he's been pushing on the outside of his foot for 8 years. So because of the fact that he's able to compensate, not everybody can do that. A lot of times people have swelling and they can't even walk with a sprained ankle. A lot of athletes can just push through it because they really don't feel the pain. But my point is compensation leads to, you feel a lot of restrictions, you feel a lot of tightness, and eventually there's one day that the straw breaks the camel's back. And so that's why you want to address it, because of the fact that if you're walking on the outside of your foot, you have to understand that if your body's out of alignment, think of a car. Your car is out of alignment, your brakes are going to wear faster, as well as your wheel or tires, right? The difference is you can just put that's like a rectangle. You can easily put that back in alignment, right? Versus the body, it's more complex. And so understanding how the body works and moves together will take you to the next level, and understand that you can use your whole foot to push off. Because you got to understand that there's definitely a lot of mechanical advantages to your body and using them together and properly.
Great question. David, this one's for you again. I'm a teenager, but always wake up with hip pain at night. Any suggestions about how to sleep or simple exercises?
Simple exercise. Do you have a growth? Have you had a growth spurt? A lot of times, teenagers will have these huge growth spurts, and what happens is, because I see kids too, a lot of my patients bring their kids in because they realize how effective it is and how much the good results they get in their 40s and 50s, and they think their kids can get it. Like, he's not moving properly. He sprained his ankle and he's not even running properly. Mm-hmm. So a lot of times when patients have these, or kids have these huge growth spurts, bones grow faster than muscle, soft tissue. And so what happens is, like Eric was talking about before, is like that muscle, that soft tissue, that connective tissue is so taut because now the bone just grew. And so what you want to do is you want to make sure release those restrictions to allow your bones to take the pressure off the tendons. If you think about where all the growing pains are, they're at your joints. So muscles turn into tendons, the tendons attached to the bones. And so if you're getting that joint pain, a lot of times it's because the muscle imbalances, the fact that you had these huge growth spurts.
Thank you. Eric, this one's for you. Can you address some of I know you talked about tenderness in the muscle tissue. So what do you experience and what do you see in your patients for tenderness and hip flexors from just, touching it? And even for patients who are minimally stretching it right around the hips, groin, sideways, that kind of thing.
Yeah, it's important to know that there should be no tenderness in a muscle when you press into it, right? The muscle fibers should spread apart very easily with pressure. There should be no tenderness. It should feel like a good localized stretch. So that's normal. So that's what we see when we've transformed someone from a very tight and inflamed client, and we transform that tissue into a healthy, pliable state. So there shouldn't be any tenderness at all, right? So that's the first thing to understand. But when tissue is tight and it's densely fibrotic and you have nerves traveling all through there, those nerves will get very, very irritated and they will become very sensitive, and that will lead to tenderness and dysfunction. And so by applying pressure into those areas with precision and breaking up some of the tightness, getting blood, getting oxygen, getting lymph and water, nourishing that tissue, there's a remodeling process that happens and it washes away the inflammation. The nerves are no longer encased in collagen. They're no longer irritated. And that's when you can apply pressure to tissue and it doesn't hurt at all. We have plenty of those cases where we actually can't apply enough pressure. And when they were first coming in, they're just screaming because it's so tender in the first few stages, but that can all be changed.
David, do you see any patients with hip tenderness, inflammation? What does that look like and how do you treat it?
Hip tenderness and inflammation. A lot of times, what we see is a lot of times when you're not recruiting the muscles, you're recruiting a lot of the soft tissue in that area in the hip. So if you're not, I'm a big believer, you don't use your muscleability, you use where muscle meets the tendon. So the muscle turns into a tendon, that's your muscle to tendinous junction. So a lot of times that gets really irritated. And so you have your bursa that's over that area that could be really tender as well, depending on where it is in the hip. a lot of these are general questions, so it's hard to get very specific. But a lot of times you'll see like it could be the start of tendonitis in that area. A lot of times, if you're not recruiting the muscles, your body just becomes really restricted and stiff, as Eric was just talking about earlier.
Eric, where can clients and everybody in the audience find their Delos Therapy? How can they
check us out. Yeah, check us out online, delostherapy.com. We have beautiful medical animations that show this fibrosis that actually happens inside of the muscle. There's a comparative analysis of what massage is doing, what foam rolling is doing, even what stretching is doing. You know, the three most common things I hear all day from patients that are coming in is stretching, foam rolling, and deep tissue massages. They say they're doing these things and they still feel very, very restricted. So that makes a lot of sense to me based on the anatomy, based on the research that's coming out, is when you have that fibrosis deep inside of that muscle, that stuff doesn't pull apart very well. If it's relatively new, it can, but if it's deeply set, it doesn't pull apart. So you're really stretching around it. You're stretching healthy mobile tissue, which is great, but it's not really breaking up the fibrotic tissue, the adhesions. And here's the surface. The tightness patterns are deep, and like I was saying, around those fascicles, deep inside the paramecium. So a massage or a foam roller going out the top, you're not really touching any of this. There's many layers of tissue before you even get to the muscle. So you're really just sort of compressing. And so I think it's important to have that visual. So go online, check out the medical animations, and then it'll click for you exactly what we're doing and how we're breaking up tissue at its source.
And your locations are here in Chicago or elsewhere?
Yeah, we have 7 locations. So we have 2 in the city, 2 in River North area. We're up in Lincoln Park, West Loop, Hinsdale, Oak Brook, and we just opened our 7th location in Winnetka. So we're very, very excited about that.
David, where can clients find React Physical Therapy? Where can they find you?
Our website is bereact.com. That's BEREACT.com. We have 5 locations throughout Chicagoland, 3 in the city and 2 in the northern suburbs. So we're in the West Loop area, Lincoln Park, Lakeshore East, Wilmette, and Deerfield.
Okay. And they're all very close to each other. So if you want to start with React, go to Delos and go to Delos at first and go to React. Locations are very close to each other. Thank you both so much. We did post the information for you in the chat for David and React, their social channels, website, and phone number, and how to reach them, as well as Eric and Delos Therapy, their website, delostherapy.com, and their social channels. Please visit. And then David, to visit you, do clients need a prescription from their doctor for physical therapy or anything to see you and get an assessment?
No, within Illinois, we have direct access, so come on in. And so we basically will check your insurance benefits. We also offer cash rates as well. And so come on in.
Okay, great. All right, well, that is all the time we have today. Thank you, David Reavy from React Physical Therapy and Eric Owens from Delos Therapy. I think this has been a very insightful webinar. We actually got a comment from one of our attendees. Wendy said, very informative, thank you. So I know our audience is very excited for this. So for our audience, thank you for joining us today, and we look forward to seeing you at our next webinar. We hope you have a wonderful day. Thank you.
Thank you.